Hello and welcome to the 2021 North Country Leadership Summit Award Ceremony. This ceremony is to honor all of our rural health champions and telehealth innovators for this year. And it goes along with the theme of emerging from a year of change and opportunity to rebuild and reimagine. Before I turn it over to our champions, I just want to give a quick thank you to our sponsors. Without them, we could not make this ceremony and the entire summit possible. So thank you for your continued support. And specifically, we'd like to point a little shout out to one of our award sponsors, Gallagher. For the Rural Health Champions, without Gallagher, you wouldn't have awards. So thank them when you get your beautiful awards in the mail. And we always love their support. They have been our Rural Health Champion sponsors for the last 5 years. So I am going to start with the Rural Health Champions, and then I will turn it over to Nancy to go over the Telehealth Innovators. This is our 2021 Rural Health Champions. We have Brenda Stiles, Barry Brogan, Linda Beers, Terri Morse, Shaun Gilliland, and Carrie Reardon. So Brenda Stiles was named the 2021 Transformation Rural Health Champion. She is the Director of Clinical Quality Improvement and Practice Transformation for the Adirondacks ACO. Rather than reading the excerpt from the nomination, I'm going to let you read it on your own, and I'm going to turn it over to Brenda if she wants to get a second to hop on. And if anybody who's not speaking could just mute so we don't have any of that crazy background noise.
Perfect. Good afternoon, everybody. Thank you very much. It's an honor to receive this recognition as the Transformation Rural Health Champion. I'm certainly not alone in the transformation process that's occurring across our region. There are many champions assisting our providers and our communities to transform the way they deliver care to our patients and clients to be successful in managing their own health and to create better outcomes for all, focusing on that whole person care. One thing I just want to bring out really quick, 2020 was certainly a time for change. And as I watch our providers, our staff, and our community-based organizations transform how they delivered care from in-person to telehealth, to assist our patients to meet their needs was tremendous. That switch on how they quickly turned over to that to transform the care, how they delivered care, their workflow documentation challenges that occurred, their billing challenges, and their staffing issues that went along with that. Even though during all of that change and all the difficulties, they remained steady. And, the change was difficult, but the outcomes were evident. People's care needs were met and their quality goals were met. And the outpouring of positive feedback from the community members was tremendous. And a lot of great things happened during that time, even though it was a difficult time and still remains that way. But it's also the work that everybody is doing to help this, transform care into that whole person view. I would be remiss if I didn't thank the Adirondacks ACO team and the HI team for their continued dedication and commitment to our providers and communities in supporting the transformation efforts across the region, as well as supporting my efforts. So thank you, everyone. And I appreciate this.
Brenda, I think Ruth Ann Craven was who nominated you, but I think the words in your nomination and just in general, the whole entire nomination was pretty incredible. So I think it is well renowned that it's a thank you to you as well. Next up is Barry Brogan. He was named the 2021 Community Collaboration Rural Health Champion. This was in regards to his work with the North Country Behavioral Healthcare Network. So Barry, I'm going to turn it over to you and let you open up your line. While you were listening to him, please feel free to read an excerpt from his nomination.
Thank you, Sara. So I just want to thank Sara Wall-Bollinger for her nomination to the Adirondack Rural Health Network and AHI. And I want to thank them also for this recognition. Also, I want to thank North Country Behavioral Healthcare Network for the opportunity to serve our 20 members over the last 23 years. It's been a great honor to do so. In her nomination letter to the Adirondack Rural Health Network, Sara Wall-Bollinger mentioned the importance of advocacy. We are fortunate to live in a state that recognizes the importance, and in fact, the return on investment that is created by supporting healthcare infrastructure in our rural communities. Over the past 2.5 decades, the New York State Office of Rural Health has administered a number of programs that deliver flexible financial support and allow rural communities and providers to address the specific needs and challenges that are unique to their communities. That being said, over the past 4 years, investment in rural health programs has waned. Some programs have experienced an over 40% cut in funding since 2017, which brings me back to the importance of advocacy. I am excited that as I begin my retirement, there is a new class of executive directors and senior healthcare managers that are moving into leadership positions across New York. It is as important now as it ever has been, that rural has a seat at the table as a potential new round of district and COVID recovery fund dollars begin to flow. I invite and indeed challenge our new leaders to actively engage in advocacy efforts on 4 important levels. First, establish a personal relationship with your state and congressional representatives. This is best done through their regional offices. Make a point to visit your representatives in their district offices at least twice a year. That's 6 visits, 2 for Assembly, 2 for Senate, and 2 for your US congressional representative. On top of that, if you can get to Albany once that reopens and to Washington, those are great visits as well. But the district offices are key. So establish that personal relationship. And then join your regional rural health network. This is where your agency's specific issues and challenges can gain a stronger voice as you join other stakeholders to craft solutions that make sense for our collective rural communities. Third, join the New York State Rural Health Association. This is where your regional issues gain a statewide voice and join in concert with other advocacy groups to present solutions to state and federal policymakers. And finally, join the Rural Health Association, the National Rural Health Association. There is no better organization to keep us informed of those issues in the federal pipeline that will affect us here at the local level. NRHA alerts us to both opportunities as well as threats in a timely manner, allowing us to provide a critical New York State rural perspective before policies are finalized. So I urge our upcoming leaders to take up the torch, take up the mantle, and to become active in advocacy. Thank you again to Sara Wall-Bollinger. Thank you to the Adirondack Rural Health Network for this recognition.
Barry, that's awesome. And actually, you may have to get an email from me as we're working on an advocacy toolkit for the end of the year. So it was perfect timing. We might need all those steps in those toolkits. So you might hear from me soon along with your award. So next up is Linda Beers. She received the 2021 Leadership Rural Health Champion Award. Linda is the Public Health Director for Essex County Health Department. Her excerpt from her nomination is below. She was nominated by Doug Meyer of Mental Health Association in Essex County. And Linda, if you want to go ahead and say a few words.
Well, let me just tell you, I am for sure a rural champion. I love, live, and work where I am, and I've never been prouder to be a representative of the Rural Health Network equally. So I am honestly so honored by Doug Myers, and it's really one thing to be nominated within your circle, but to be nominated by a group outside of the circle in which I normally hail I was just blown away by that. So I thank him specifically and all of the folks. I know he reached out to folks that we all work with in the Essex County Heroin / not opioid, but other coalition. So I would just, I wanted to be really mindful that I thank for my, optimistic attitude, that I work with some amazing people. My staff here have been just troopers and just fabulous in working with the Essex County the Elizabethtown Community Hospital, AMC Hospital, and Hudson Headwaters Health Network certainly have helped and been valued partners in moving the COVID isolation, quarantine, and all of the responses forward. The Essex County Heroin Opioid / Other Coalition met for the first time in a long, long time. And I was asked to convene that by so many partners, and it was really thrilling to get back in and, really just look at gaps, and also though really see where we have moved to. And that leads me to really, the what I call collateral damage of COVID. I see it from the pure health of it, but I talk to every person in isolation and every person in quarantine that's talked to by the Essex County Health Department. And we can see and we can feel the toll that it's taken on people's mental health, which has led to substance use disorders and an increase in that, increase in suicide, and increase across the board in so many disparate populations. And I thank my colleagues in other departments such as DSS and Terri Morse being recognized today. Equally shout out that I would never have been able to pull this off if not for the leadership of the Board of Supervisors, AKA Shaun Gilliland, and why I nominated him. Essex County has a unique structure in government. Our Board of Supervisors is our Board of Health, and therefore there's at any given time, 18 masters. I hope that number's right, Shaun. You'll have to clarify that. But early on in the pandemic, the board came forward and said, let's just have you really focus on one person. And so I really had the last 18 months to work with Shaun and really value his partnership as well. And thank you for this award for everybody who thought I worthy. So that's it.
Linda, that was great. I love that you're recognizing our champions coming up. That's even better. I'll turn it right to Terri then. So Terri was named the 2021 Behavioral Health Rural Health Champion. Terri is the Director of Community Services for Essex County Mental Health. Her excerpt is below. She was nominated by David Clement from Essex County Mental Health. And Terri, if you want to come on, I don't see your video, so I'm assuming you're somewhere here. There you are.
Good afternoon, everyone. It's a great honor to be recognized by staff members of Essex County Mental Health, especially in this manner. While I, as an individual, have received this award, I feel like it's a shared recognition. And certainly all the staff of Essex County Mental Health, brief coordinators, I'll explain what brief is in a moment, and all the organizations who are members of brief are standing here with me. So Essex County's system of care, called brief, which means building resilience in Essex families, has a vision. And that vision is that all families in Essex County will reach their full potential and achieve wellness. And that includes a family of one, and it spans all age groups. So it's not just about kids. We want to strengthen the individuals in our communities, but we also want to strengthen our communities. It is our goal for brief and its partners to become a source of support rather than the necessarily being the source of support. We want to emphasize and build on the concepts of communities lifting up their own community members. And our goal is to build a proactive as compared to the previously reactively driven organizations by regulatory agencies in New York State. I say that with much respect to the agencies, but I feel like we need to be more proactive in our approach. Again, thank you all for this award. I'm honored, and I promise to all of you to continue to keep the faith and the energy toward helping those in recovery and improving their wellness. Thank you.
Well, you're getting a round of applause. I love it. Congratulations. And then we have Shaun Gilliland. He was named the 2021 Community Empowerment Rural Health Champion. Shaun is the town supervisor for the town of Willsboro through the Essex County Board of Supervisors. He was nominated by Linda. So we're happy to have his nominator right here on camera. Shaun, did you want to hop in and say a few words?
Well, sure. This is very much of a surprise. I'm not in the health business, though I found myself in it, by by fiat, essentially, and it's, it was tremendous working, and we're not done yet, of course, but over the last 18 months or so, working with Terri and with Linda Beers, tremendous partners in all aspects of health. It's in one thing, I had the learning public health on steroids course, dealing with pandemic issues. If I didn't have such wonderful partners in that and a supportive board, I mean, it wouldn't have happened. But the other thing we actually learned too was, in for rural counties and things, it's, you just, you can't rely on just the professionals in the field. I mean, it's a whole team effort of every department, and volunteers such as the Medical Reserve Corps. And, it was more of an act of bringing disparate expertise and skills together and putting people in the right place at the right time to help out. I would, my role was not that great, except, where you stand is where you sit, and I happen to be sitting in the chair. And I'm extraordinarily humbled by this, and I will say that for the rest of my life, I'll remember this this particular challenge and how we were able to overcome it with working with such tremendous people is one of the greatest things that I've ever experienced. So I want to thank you, and I want to thank all our employees, Essex County, particularly public health and mental health. They are truly superstars, and they have faced the monster and defeated it, and I'm extraordinarily proud to be a part of it.
I definitely think you had great teachers. You're also getting a round of applause. I love everyone's speeches this year. I feel like they really came with passion and power, and I think that's something that shows exactly why you're earning the award. So kudos to all of you. Our last champion is Carrie Reardon. Unfortunately, she was unable to be here, but Carrie Reardon was named the 2021 Community Impact Rural Health Champion. She is the AVP of Patient Services for Adirondack Health, and she was nominated by Matt Spolin. I'll leave it open for just a second to read her nomination excerpt, and then I'm going to turn it over to Nancy DelMastro to go over the Telehealth Innovators. But for all of our champions, we were so honored to be able to recognize you guys, and the leadership and the true work that you do for the communities is so important. And so we appreciate everything you do, and we hope you continue to do it with ease, because that's what it looks like on our end. And congratulations again. Nancy, I'm going to turn it over to you.
Thanks, Sara. Again, this is Nancy DelMastro. I am the Telehealth Project Manager at AHI on behalf of the North Country Telehealth Partnership, which is a partnership between AHI and Fort Drum Regional Health Planning Organization. Want to thank everyone for joining us and congratulating our 2021 Telehealth Innovators. I want to give a quick shout out to our second award sponsor. This is West.com. Thank you so much for supporting our conference, and especially our Telehealth Innovators. We are celebrating 3 Telehealth Innovators today. We have Layden Johnson of Centers Healthcare, the Family Counseling Center's Warm Line team, and Anne Marie Hatch of Glens Falls Hospital. Quickly, before we get into each of our winners, wanted to give a brief background of the award. The Telehealth Innovator Award is given to an individual or group that has advanced virtual care in the face of adversity amidst the global pandemic, which has led to improved health outcomes in the community and improved quality of life. Contributions towards telehealth excellence and growth, including program expansion, patient impact, and innovations, are all celebrated today. Next slide. Our first telehealth innovator is Layden Johnson, the Regional Director of Social Work at Centers Healthcare. You want to go ahead and unmute yourself and say a few words?
Thanks so much, Nancy. I want to just take this opportunity to thank everybody at the Adirondack Health Institute and the North Country Telehealth Partnership for this amazing award. It certainly came as a surprise to me, but recognizing everything that has occurred in long-term care over the last year and a half and ensuring that our patients get what they need has certainly been a challenge, but telehealth has really, brought us very far. I want to also take this opportunity to thank my center's healthcare colleagues, Yahesko Millworm, Samantha Green, Kirsten Massa, and Jeff Jacomowitz. And I also want to thank the leadership at all of our Adirondacks facilities in Queensbury, Glens Falls, Granville, Argyle, and even all the way up there in Elizabethtown for welcoming the telehealth services into their facility. Without their willingness and openness, we certainly wouldn't have made this happen for all of our residents. Telehealth is an amazing technological advancement where the residents can truly benefit from receiving all of the necessary medical treatment without leaving the confines of their comfortable facility. It's their home, and being able to receive those services in their home has really been a game changer for all of our residents and for our staff. It fully erases any chance of getting hurt or being open to any viruses such as the flu and COVID-19. As a longtime social worker, I have always lived by the motto that the health and safety of our residents is our first and foremost priority. And both telehealth and telepsych sit at the top of all of our nursing homes and rehab facilities through the Adirondacks and the Capital Region. It is an important part of the work that I've done as a social worker to ensure that all residents have access to the services that they need. Having the ability to access these services has undoubtedly improved their quality of life during the pandemic and beyond. And I look forward to seeing what is to come with all the services that we have in our facilities. Thank you so much for this award.
Thank you and congratulations again. Our next innovator is the Warm Line team of the Family Counseling Center of Fulton County. The team consists of Jamie Spraker, Kim Smith, Kathy Calabrese, and Ron Weaver. If the team wants to go ahead and unmute and share a few words.
You can try and unmute now. Sorry, guys.
Can you hear me now? The problem is,
Yes, but there's a large echo. Maybe just unmute the phone number and not the camera. I don't know. See if that works.
can you hear us?
Yes.
Can you hear us now? Oh,
Yep.
good. Well, good afternoon. I'm Kathy Calabrese, the former Children and Family Services Director at the Counseling Center. The team, Ron Weaver, Kim Smith, Jamie Spraker, we are all very honored to be recognized for the work on the Warm Line during the COVID-19 pandemic. During that unpredictable time, it was fearful for everyone, I think, involved as far as COVID. The Warm Line not only helped the stress callers, but it also helped the staff who were manning the phones. We used our own advice to remain strong during this difficult time. Some of the things that we recommended that we were doing ourselves was limited time listening to the news that involved COVID and the increasing number of deaths, doing something creative, finishing projects that we hadn't finished or we had put off, trying to do new hobbies, reading, watching uplifting movies, exercising, anything to boost your morale. One woman actually that was struggling with her own mental health, she would call regularly, and each time we would develop a plan to give her an incentive to get through the day. We received hundreds of calls from as far away as California. The warm line allowed us to help others by being a calm voice on the other end, offering advice or just a listening ear. We assured callers that we are all in this together, and we would get through it together. Being chosen as the recipient of the Telehealth Innovator of the Year Award from the Adirondack Health Institute is an immense compliment, which validates our work at the Counseling Center. So we want to thank you very much.
Thank you so much. It's very inspiring to hear that you all were able to be so strong and such a pillar in the community during this tough time.
Thank you.
And our final innovator is Anne Marie Hatch, Senior Director of Physician Practices at Glens Falls Hospital. Her excerpt is also on the screen if anyone wants to take a look at that. And Anne Marie, the floor is yours if you want to say a few words. Thank you.
Thank you, Nancy, and good afternoon to everyone. I have to say I'm both honored and humbled to be named a Telehealth Innovator of the Year nominee. It was quite a surprise, and I'm not used to having surprises. I'd like to put a gracious thank you out to Dr. Alex Marcel, who is Chief Clinical and Science Officer for Abdi Health, and his nomination. We embarked with telehealth with Abdi Health back in August of 2020, which was really pre-COVID. And it was something that we had been toying with for a long time to be able to reach the masses of patients that we needed to get to via telehealth. It was a wonderful precursor for us to what was about to come. Specific to Abdi Health, this has really allowed for Glens Falls Hospital to provide an intelligent virtual behavioral health access to some of our most vulnerable patients. It was a wonderful way to connect the dots for both physical and behavioral health services so that we could provide a more holistic approach to care for our patients. This model has truly permitted us a fully integrated model that is personalized and private for our patients. And it has mitigated many of those social barriers or stigmas to health and overall increased the value for the service. I think it was Brenda that actually used the terms of, I would be remiss to not acknowledge some folks. And that's really what's key. It's not one person, it's a team. And I'd like to acknowledge the North Country overall for your continued efforts to make sure that we provide services to rural areas. Our Glens Falls Hospital leadership team, never once did they say, "Are you sure?" It was, "Let's keep going." Our providers and our operational leaders who had to really think beyond the pandemic emotions that they were faced with. Our IT team who moved with strategic swiftness to make sure this would happen. For our major telehealth, from we should think about telehealth to having our first patient was only 72 hours. It was amazing. And then to our patients who really had to embrace that changing environment. It was a challenge for many, but we never gave up. Nobody did. I'll keep it short. I just want to close by thanking each one of you on this call for your commitment to this initiative and to the communities you serve. This is definitely a team of excellence here today. And, as we remember and respect all the toils that the pandemic has brought to us, I really hope that we don't forget some of those golden nuggets that we found along the way, the camaraderie of everybody working together and the teamwork for a common goal. And one of those is definitely telehealth. We need to keep that going and don't think it was a phase. It's a journey that lasts forever. So I just wish you all the best, and I hope that you all take care of yourselves as well as your patients.
Thank you so much, Anne Marie. Those were great words to close out our final winner. I couldn't agree more. With that being said, that was the end of our honoring of our rural health champions and telehealth innovators. Congrats to all of you once again. We will continue celebrating our regional champions with a spotlight on National Rural Health Day, which is coming up November 18th. Mark your calendars. There'll be advertisements and displays through social media to again celebrate the amazing work all of you have been doing throughout this year. And we will also be honoring you all with ads on the AHI website as well. I want to thank everyone for joining us this afternoon in congratulating our rural health champions and telehealth innovators. Congrats once again for the tremendous work you're doing, and thank you.